Joe here, coming to you with my weekly legislative update. Two things I wanted to talk about. The first thing I wanted to talk about was an event I just got back from just a few minutes ago in Whiting. We had a town hall meeting. There was about 10 people there, and we were scheduled for 2 hours. It went on for 2.5 hours. The same 10 people there the entire time. We could have gone on and on because as we decided we had to wrap up, we were talking on our way out the door. And so it was such an awesome thing to be able to sit down around a table with neighbors and just talk about what's going on. And it was so cool because it wasn't a partisan conversation. There were very conservative people there. There were very liberal people there, all parts of the political spectrum. And we weren't taking, my side says this, your side says that, or whatever it is that unfortunately we see so much in politics these days. But we were neighbors talking about the problems we see in our community and bouncing ideas back and forth of how we might be able to solve them. And that's so amazing to me because, I'm a representative and I take that title very seriously. My job is to represent the communities that I was elected to represent. And there's people in our communities from all sides of the political spectrum. And so it's important, I think, to have those conversations and try to figure out where is that common ground? Where is the place that we can come together? Where is the place that we can make everyone feel heard and everyone feel part of the process? And I also think by doing that, we come up with the best solutions because the best solutions come from all of us working collectively together on the challenging issues that we face. And I think that it's so important to have those conversations as frequently as we can, bringing people together of different political parties, different political sides, and having those conversations. So thank you to everyone in Whiting who showed up. I really, really appreciate it. Thank you to Carolyn who organized it. I asked her if she could help, and she sent a postcard to every single person in Whiting. She put up signs and everything like that. It was so nice of her. And I will be doing other events in other towns. I will always be putting those on my Facebook as events. And so please, take a look at my Facebook, J. Andriano for VT, if you want to keep up with them when those events are occurring. And it will be really great to see people there so we can continue these conversations between everyone thinking about these challenging things that we're working through and finding how we can find these common ground solutions and common sense solutions, which was a big part of our conversation about how do we find common sense solutions to things that sort of can seem very obvious on the grassroots, and then you sort of wonder why it's not happening higher up. And that was a big part of what we talked about. It was a really cool conversation. So again, thank you everyone in Whiting who made that possible. The second thing I wanted to talk about is healthcare. You may have seen if you subscribe to VT Digger's Final Reading newsletter, or if you went on the VT Digger website, that a quote that I had in my committee meeting actually was the headline for VT Digger's daily legislative session newsletter, again called Final Reading. And first I have to say it's nuts when you say something and then you see it as a headline in the news. It's cool, because I believe so strongly what I said. What I said is that Vermont's healthcare system is a village on fire. And the reason I said that was that we're having conversations in our healthcare committee about what's going on in our healthcare system today. And we learned so many things. I'm not even going to begin to scratch the surface of these things. I did a social media post about it, but we are seeing people wait in emergency rooms for beds, psychiatric beds in particular, particularly children, for days, if not weeks, if not months. On Friday, one of the last things we heard from a woman whose son, 11-year-old son, was in an emergency room with complex psychiatric and other medical needs in a windowless room for 11 days. And this woman, this mother, told us how her son was tethered to a bed for 11 days because they could not find a psychiatric bed in this state or in 5 other states to take him in. And she said how the doctor told her that she should give her son up to DCF because he would get a psychiatric bed faster, and she didn't do that. That is so sad, and that's just one story that we're hearing. And we know from the statistics that this is happening to more than just one person. This is happening to children, to people all across our state every single day. As you are watching this video, there are most likely children who have been waiting in an emergency room for a psychiatric bed for at least 24 hours, if not more. We heard about how overdose deaths and suicides are trending above 3-year averages. We heard about how people who are unable to afford dental care are losing their teeth and dentures aren't covered. We heard about how the hospital system is losing overall on average 1.9%. A negative operating margin is what they called it. And then on top of all that, we heard about our healthcare workers who are facing violence, physical violence, and abuse every day in this state. And we have to come together and fix that. We all rely on the healthcare system. We all can be sick. We all can end up in the ICU. And I think it's our responsibility as legislatures, and also our responsibility as a community to try to figure out how that is happening. I think about our providers, and I think about how hardworking they are. And I've talked to constituents who are providers who work in the hospitals who have personally told me these stories about how they are being abused, about how they're being yelled at, about how they're facing physical violence, about how they are observing physical violence against their coworkers on a daily basis, and about how they are going after their shift into their cars and they are crying, and then they are coming back the next day. We heard testimony from a nurse who came to our committee who told us this, who told us about him and his colleagues going to their cars and sobbing because of the abuse. Our healthcare system can't work without our providers. They're necessary part of this. Our nurses, our doctors, our receptionists, every single person who works inside the healthcare system is necessary to keep you and I healthy and safe. And so, and part of that, of course, also is, what are these bottlenecks that are keeping people in the emergency rooms for days, weeks, months in some cases that we've heard about. So that's why I called it a village on fire. I called it a village on fire because of that. I also called it a village on fire because what I was learning in that particular session when I said that is that last year, a law was passed to put some significant federal dollars at this. And that was a law that was passed and was signed by the governor. And we learned that none of that money has flowed. There's workforce development money to help get us more providers, help alleviate the incredible burden that providers are facing on a daily basis, the abuse they are facing on a daily basis. And that money, a year later, has not flowed. And so I said, it's like we're trying to fight the fire of our village on fire. And last year, all these hoses were rolled out. And we're there because we want to pick up a hose because we see this thing that is so important to us burning down, and the water isn't getting out, the money isn't flowing, so these things can happen. And I want to know why. Because this is something that touches each and every one of our lives, and I just can't stand to hear about children who are languishing in our emergency rooms, adults who aren't able to get the care that they need, and providers who have given so much during this pandemic, so much during this pandemic they have given us. And and we're asking more and more and more of them, and they are pulling from reserves that they didn't even know that they have, and then people are abusing them. So we need to do something. I feel very fortunate that I am on the healthcare committee, so I can continue to look at these issues, and so I can continue to find out what is going on. So those, it's a little depressing, and I'm sorry about that, but that is what I'm learning in my healthcare committee. This is the testimony that we're hearing. These are stories I'm hearing from you, my constituents, my neighbors. And I think it's important that we tell these stories. I think it's important that these stories get out beyond the House Healthcare Committee, out into the wide world, so all Vermonters can hear these stories. And so that's why I felt, very lucky that my quote was picked up by BT Digger, because if that quote made a person read that article and see, as they list in that article, all these statistics and more statistics than I just told you, I think that we would really rally together as a community, as a statewide community, to try to tackle this, because it needs tackling. It really, really needs tackling. And just talk to a friend who works in the hospital, talk to a patient who's been through the ringer with the healthcare system, and I'm sure some, if not most, if not nearly all of you who are watching this video right now have a story to tell about this. And if you feel comfortable sharing that story, please reach out to me, because I would like to hear that story, because I think it is very, very, very important that as a representative, and particularly as a representative on the House Healthcare Committee, that I hear the stories that are occurring for patients, for providers, for all of us in the state, because I think stories are so powerful in us trying to understand the problem and then trying to come up with solutions. So thank you so much for listening. Please keep up on my social media. I post pretty much every day on social media about what's going on, about at least one interesting thing I learned that day. So I hope that's valuable to you. It's something I intend to continue doing. So please, follow me. I am on Facebook, JAndriano4VT. Also Instagram, also Twitter. You can find me on most social media platforms with that handle. And always feel free to reach out, to comment, whatever it is, because I'd like to continue these conversations, whether it's in person, on the phone, or even in a virtual setting like that. So thanks so much for listening, and I look forward to talking to you soon.